pelvic floor are the muscles that attach to the pelvis, to the sacrum, that kind of triangle bone in the back, to the tailbone, the coccyx here. And they work almost like a little hammock to hold up and support our organs. So this is an intricate network, and it looks like a little bowl. So we have superficial muscles, and then we have deeper muscles of the pelvic floor. And what's interesting is some of the muscles of the pelvic floor, well, a lot of them attach to the pelvis, to the sacrum, to the coccyx, the tailbone. Something fell. Real life. And they also attach to the hip and help with external rotation and assist with that. And I personally believe that, right, it's one body, it's all connected, and it's an intricate system here. And what was interesting for me, and research has now come out and shown this, that if you have somebody who is having pelvic pain, and that could look like painful periods, pain with intercourse, pain with pelvic exams, maybe even leakage of urine, you have a little bit of bladder leakage, you're struggling with pelvic pain and it's not going away, and we've done traditional pelvic floor PT, that it's worth getting a screening done of your hips, because it could be an underlying hip pathology like a labral tear or impingement or dysplasia. They go hand in hand. And vice versa, I would say that if you've had surgery on your pelvis and on your hips, it would be a good idea if after surgery you feel like you can't completely empty your bladder, or you're leaking urine, or you are having sex and it's painful, or pain with wearing tampons or periods or anything, it would be worth getting an evaluation done by a pelvic floor PT, because these muscles, just like muscles in our neck or in our shoulder can go into spasm and tighten up and can get knots in them, the same things can happen to the pelvic floor. And a pelvic floor PT can do an internal exam, either vaginally or rectally. Yes, men have pelvic floors too, and we check it rectally. But to check those muscles to see what's going on, because so oftentimes, and I would say specifically ask your doctor for this, because this is my own soapbox, but many times if women are leaking urine or they're struggling, they're just told to do Kegel exercises. And if you try to strengthen a spasmed muscle, it can make the spasm worse. And so women that are going in and struggling, and then they're doing all these Kegel exercises, one, they might not be doing them properly, which is why we want to work with a pelvic floor PT to check and assess. But two, it could be making the pelvic pain issues worse, the urinary leakage worse, all of that. So this is why I think they kind of go hand in hand. And yes, so many times, right, with hip patients, we're like, strengthen the glutes, strengthen the rotator, strengthen your core. But the pelvic floor actually works synergistically with, we've got the pelvic floor on the bottom, we've got the diaphragm on the top, we've got the transverse abdominis and the core in the front, and then the back extensors. And all four of these areas work synergistically. And so it's my personal view that it would be really good to find a pelvic floor PT in your corner to get an assessment and look into things, and that pelvic pain could be a symptom of an underlying hip pathology, and an underlying hip pathology could be creating issues with your pelvic floor. So it's good to look at all of those. And Herman and Wallace that's the institute that I did my pelvic floor training with. And I believe their website is pelvicrehab.com, and they have a provider, and you can find a pelvic floor PT in your area. You can find a practitioner near you to get an assessment. And again, not all OB-GYNs or orthopedic doctors or people are up and up on pelvic floor PT. So ask about that and find one near you and get an assessment. It's not going to hurt. And I actually think it would be a huge part of your recovery to get everything assessed and working together to stabilize your pelvis and your hips.
That's amazing. And there's so much that you just said that I had no idea about. So, every physio has their own area of specialty and expertise. And yeah, there was so much that you just talked about that I had no idea about. So I don't know if this sounds like a silly question, but you've talked about, you don't want to just strengthen a potentially spasmed muscle. So if you've got a byproduct of hip surgery or vice versa, whichever way around it is, and you have a pelvic floor that is potentially too tight or too spasmed and doesn't know how to relax, what would a pelvic PT do to release that? Like, are there manual techniques that you can go in? Obviously you've described like an internal exam that you can do. Are there things that people can do themselves to help release that tension, or is that something that you guys do to give that relief manually? What's the sort of process?
Both. Yeah, both are really key. So when you first work with the PT, they can actually do biofeedback where we put these little stickies kind of on either side to just assess the pelvic floor. And we can tell if it's chronically tightened. Some people are like squeezing their butt all the time and their pelvic floor is constantly activated. Or similarly to if you have a patient come in and they're having neck pain and they walk in like this and they're like, I don't know why my neck hurts all the time. Like, and we're like, like, let's
Relax
relax.
those shoulders.
We can be doing that with the muscles of the pelvic floor. They are voluntary muscles. We can tell them to contract and relax, but we may just be chronically tightening them. Plus the pelvic floor, it's a protective space, right? Like it's controlling our bowel and bladder functions. But when we don't feel safe, we tighten the pelvic floor. We close off the vaginal opening, the anal opening, everything kind of tightens up and closes. So sometimes they'll do biofeedback to just kind of see, are we able to contract the muscle and fully relax the muscle? But I will tell you this little secret. You don't want to work with a pelvic floor PT who only does biofeedback and they do no internal exam. That's not true pelvic floor PT, by the way. So you want to get with somebody who's actually going to do manual therapy, and they'll go in through the vaginal opening and they can basically kind of feel and check these muscles and kind of go, okay, it's a little tight here. And it's interesting when you're palpating muscles of the pelvic floor because you'll feel that tightness. And usually the patient, I can kind of be like, oh, they'll be like, yeah, that's tight. I'll get feedback on that. And you can apply a little bit of pressure and hold for 60 to 90 seconds. And you will actually feel that muscle soften just like you would if you have like a tight spot on your arm. You'll feel it kind of soften, and then you'll feel blood flow come back into the muscles and start to feel a little bit of a pulse, like as it starts to relax. So it's helpful to have somebody else check those because an OB-GYN doesn't. They bypass the muscles. They're checking your organs. They're making sure that everything is good there. But physical therapists come in as the musculoskeletal people. So we can kind of check those muscles and go, okay. And then we can teach you. There are things, there's a crystal wand, there's different things that you can do and learn to release those muscles internally on yourself as well as externally. There's things that you can do. So work with that pelvic floor PT because they can do an assessment, they can do an external exam of the pelvic floor as well as internal, and help you with a home exercise program to where you can start releasing those muscles as well. Because just like we get tight spots, right? Maybe our hip flexors tight, or we get tight adductors or something, and all of that attaches, right, to the pelvis. Like it all comes back here. This is kind of home base, pelvis and hips and core. So work with your pelvic floor PT. They're going to be a great resource. And the whole goal is to help you be independent, that they can kind of support you and then get you on a program so that you can release those muscles on your own. And it's almost just bringing awareness of like, oh, I think I'm tightening up, just like with the shoulder issues or the neck. It's like, oh, how can I, or I'm just noticing a little bit of tension there as we talk about listening to your intuition in your body and taking some deep breaths into the pelvic floor and allowing that to relax.